Although it is difficult to accurately identify the causes of emotional or behavioral disorders in students, several interactive factors probably contribute. One major category is biological. The other category is environmental. Research shows that genetics influence the behavioral characteristics of children. Students who are exposed to trauma and maltreatment are more likely to experience emotional and behavioral disorders. The risk of a student developing an emotional or behavioral disorder is more likely in children who live in poverty. Research also suggests a link between children in volatile foster care placements and behavioral disorders. Students who have experienced abuse may display poor self-image, an inability to depend and trust others, aggressive and destructive, sometimes illegal behavior, passive and withdrawn behavior, school failure, and serious drug and alcohol abuse. Students, especially boys, who experience peer rejection and aggression at school may be more likely to develop conduct disorders. Bipolar disorder, also referred to as manic depression, is characterized by exaggerated mood swings. The student will experience phases with heightened levels of activity, ideas, and energy, along with periods of depression and possibly anger.
Jeez, God. Destiny, what are you doing? We're still at it.
The deadliest of all psychiatric conditions, anorexia, is characterized by an obsessive concern with losing weight and ultimately manifested by a refusal to eat.
I don't want this.
Sophia, you haven't eaten anything all day.
I don't want it.
Bulimia nervosa is characterized by frequent episodes of binge eating, from twice a week to multiple times a day, followed by frantic efforts to avoid gaining weight. During an average binge, a bulimic consumes 3,000 to 5,000 calories in one short hour. After it ends, the person turns to the drastic measures to undo the binge. Flashbacks and other recurrent symptoms following exposure to an extremely distressing and dangerous event are characteristic of post-traumatic stress disorder.
No. No. Don't hurt me again. No.
Schizophrenia is a disorder characterized by two or more of the following symptoms: hallucinations, withdrawal, delusions, inability to experience pleasure, loss of contact with reality, and disorganized speech. Symptoms of oppositional defiant disorder include arguing with and defying adults, swearing, and using obscenities.
Sophia, honey, it's a school night. You need to stop playing the Wii and go to bed. You're going to be tired in the morning.
I can do whatever I want. I'm almost a teenager, so shut the
Bleep.
up.
Extreme oppositional defiant disorder symptoms characterize conduct disorder, which can be identified into 4 categories. Aggressive conduct resulting in physical harm to people or animals is the first category.
One shirt. Oh yeah, that was a good one.
Non-aggressive conduct causing property loss or damage, serious rule violations, and deceitfulness or theft make up the other three categories. Obsessions manifesting as repetitive, persistent, and intrusive impulses, images, thoughts, or compulsions, such as hand-washing and counting, characterize obsessive-compulsive disorder. Generalized anxiety disorder is characterized by excessive, overwhelming worry not caused by any recent experience.
Oh my god, I'm so hot. I'm freaking out. I hate when I get panic attacks.
Rapid heartbeat, dizziness, excessive sweating, and heavy breathing are symptoms of panic disorder. Phobias are characterized by an unrealistic, overwhelming fear of an object or situation.
Some phobias include a fear of heights or spiders, and even leaving the house. We hope as future teachers, you will use the knowledge you've gained here to better identify students in your classroom with emotional and behavioral disorders. Thank you for watching, and thank you to our wonderful actors.